In this eye here, you can see chronic pineal gland, okay, and chronic pituitary gland. You also notice that you see that the eye, this is the eye region right here, all the way here is the sinuses. Eye, nose, mouth, upper jaw, lower jaw region, heavy lymph stagnation, so this congestion in the sinuses. Right here you can see the thyroid is also chronic, and beside is the parathyroid, also chronic as well. The parathyroid is what deals with calcium utilization and tissue integrity or strength, okay? So when it's weak, you see weak evidence of weak tissue, like the bowels here, okay? You can see it's quite constricted. Right here is the esophagus, okay, region, okay, and the scapular region as well. You can see it's quite congested with lymph. Right here is the upper, middle, lower back region, okay, and the spine runs right here. You can see it's very congested with lymph. So when you see all that white cloud-like structure, okay, all that's lymph. When it's white, it's acute level of lymph stagnation. When you see the yellow like here, that's subacute lymph stagnation, okay. And when you see it a bit to the brown side, that's chronic, you can move to chronic side. So you have a lot of lymph stagnation in the eye. You can see right here the skin ring, very dark ring around the eye, indicates that you are not sweating properly due to a weak thyroid, which I showed you right here, a weak thyroid. Okay, so that needs to be cleaned up as well. If you look also very closely, you see rings going around the eye. That's a nerve ring, okay, that indicates that you have a weak nervous system function, okay. And then you see very closely those white dots, those lymphatic rosary, indicates that your lymph nodes are swollen or stagnated and not flowing properly and should be addressed. Right here is the vagina, uterus, and the bladder region right here. Right here is the kidneys and adrenals. You can see the chronic side. When you have chronic kidneys, you're going to have a skin ring because the skin tries to take the burden from the kidneys, but it's not as efficient, so you see a dark skin ring as well. That and the thyroid as well. Adrenals, weak adrenals will give you the nerve rings. You see the rings going around the eye. Also, if you look closely around the bowels, you see a yellowish line going around the bowels. That's the autonomic nerve wreath. Indicates weak digestion, okay, or slow digestion. So the nervous system is weak due to weak adrenals, so it needs to be addressed. Right here is the right foot, knee, and thigh region. You can see it's also chronic as well. Right here is the groin, urethra, and pelvis region. Right here is the testes, or ovaries, and the pancreas. You can see it's the chronic side as well. Right here is liver and gallbladder. You can see the gallbladder is moving to the chronic side, so it's also congested. You need the liver because liver is the chemical factory of the body and produces all the hormones and chemical transmutations. So it's crucial you detox that. Use the liver and gallbladder tincture. Right here is the rib section, okay. You can see it's quite congested. Right here is the breast, where it's located. You can see it's quite heavy with lymph. Right here is the upper and lower lung region. You can see it's also heavy with lymph stagnation to the acute side. Right here is the neck and shoulder region. You can see it's quite heavy with lymph as well. And right here is the mastoid medulla and cerebellum region. You see it's quite heavy with lymph as well. Now, the mastoid medulla is responsible for balancing equilibrium. The cerebellum right here is also responsible for communication between the brain and the rest of the body. So it needs to be detoxed. The entire brain section is quite chronic. You can see red eye solaris, that's fine lines leaching out the bowels. Okay, these are toxic tunnels of waste leaching out other body parts and glands, but especially in the head brain region. You can see it's yellow. That's subacute lymph stagnation. The yellow could also indicate sulfur. Okay, and the bowels are also very prominent. They are quite constricted. You can see right here. Okay, the ascending colon, small intestines are constricted. The transverse colon is the chronic side, and the descending colon is also constricted as well. So you should clean the bowels, the GI cleaner. There's also a malabsorption ring around the pupil right here, and that comes about when your small intestines are blocked with mucus plaque and you can't absorb nutrients properly. So you need to clean that out, the GI cleaner.